Depression is a common and serious mental illness that causes persistent feelings of sadness and/or results in a loss of interest in activities once enjoyed. It can lead to a variety of emotional and physical problems that decrease a person's ability to function at work and at home. Left untreated, depression can be devastating for patients and their families. Fortunately, it is the most treatable of mental disorders. Between 80% and 90% of people with depression eventually respond well to treatment, and almost all patients gain some relief from their symptoms with early detection, diagnosis, and a treatment plan consisting of medication, psychotherapy, and healthy lifestyle choices.
Depression is typically categorized as a serious mental illness that causes mood disorder. To be diagnosed with depressive disorder, a person must have experienced a depressive episode lasting longer than 2 weeks. Although symptoms may vary, common diagnostic criteria include feeling sad or having a depressed mood, loss of interest or pleasure in activities once enjoyed, changes in appetite, such as weight loss or gain unrelated to dieting, loss of energy or increased fatigue, feeling worthless or guilty, and thoughts of death or suicide. General medical causes, including medical conditions such as thyroid problems, a brain tumor, or vitamin deficiency, can mimic symptoms of depression, but they must also be ruled out. You may also be asked for an interview or possible physical expression to identify specific symptoms, medical and family history, cultural factors, and environmental factors to arrive at a diagnosis and plan a course of action.
There are many determined or theorized causes about the brain chemistry and/or cognitive functioning that are associated with major depression. Life events and circumstances may also lead to more depression.
The differences in certain chemicals in the brain may contribute to symptoms of depression. Unfortunately, the evidence is somewhat indirect on these points because it's very difficult to actually measure the level of neurotransmitters in a person's brain. Current research suggests that a decrease in the production of serotonin, a deficiency of the neurotransmitter noradrenaline, having a noradrenergic system, and low dopamine levels can explain why depressed people don't derive the same sense of pleasure out of activities or people that they did before becoming depressed.
Depression can also be caused by genetics. For example, if one identical twin has depression, the other has a 70% chance of having the illness sometime during their lifetime. Personalities can also play a role, as people with low self-esteem, who are easily overwhelmed by stress, or who are generally pessimistic appear to be more likely to experience depression. Additionally, so are people who have a history of sleep disturbances, medical illness, chronic pain, anxiety, and ADHD. Some medical syndromes like hypothyroidism can mimic depressive disorder. Some medications can also cause symptoms of depression. Finally, continuous exposure to violence, neglect, abuse, or poverty may make some people more vulnerable to depression.
As brain chemistry may contribute to an individual's depression, antidepressants, mood stabilizers, and antipsychotic medications may be prescribed to help modify one's brain chemistry. Antidepressants may produce some improvement within the first week or two of use, but full benefits may not be seen for 2 to 3 months. If a patient feels little or no improvement after several weeks, their psychiatrist can alter the dose of the medication or add or substitute another antidepressant. Psychiatrists usually recommend that patients continue to take medication for 6 or more months after symptoms have improved. Longer-term maintenance treatment may be suggested to decrease the risk of future episodes for certain people at high risk.
Psychotherapy or talk therapy includes cognitive behavioral therapy, family-focused therapy, and interpersonal therapy. It is sometimes used alone for treatment of mild depression, for moderate to severe depression. Psychotherapy is often used along with antidepressant medications. Cognitive behavioral therapy, CBT, has been found to be effective in treating depression. CBT helps a person to recognize their own distorted thinking and then change the behaviors and thinking based on that. Psychotherapy may involve only the individual, but can also include others in group therapy. Depending on the severity of the depression, treatment can last a few weeks or much longer. In many cases, significant improvement can be made in 10 to 15 sessions.
Brain stimulation therapies can be tried if psychotherapy and/or medication are not effective. RTMS is a non-invasive method of brain stimulation that relies on electromagnetic induction, using an insulated coil placed over the scalp, focused on an area of the brain thought to play a role in mood regulation. Electroconvulsive therapy, ECT, is a medical treatment most commonly used for patients with severe major depression or bipolar disorder who have not responded to other treatments. It involves a brief electrical stimulation of the brain while the patient is under anesthesia. A patient typically receives ECT 2 to 3 times a week for a total of 6 to 12 treatments. ECT has been used since the 1940s, and many years of research have led to major improvements. It is usually managed by a team of trained medical professionals.
John Nunn was a college student who lived with his parents. John reported that he was finding college increasingly difficult to cope with. Last year, he had failed one of his major exams and had to repeat it. He said that this had really affected his confidence, and he started to experience increasing levels of anxiety and difficulty in applying himself to his studies. That was then exacerbated by the increasing tension of his parents over his poor college performance.
It is common to find some college students who drive themselves too hard. This works for a while when they start college, but as they demand that they must never fail, they can develop structural and functional vulnerabilities in their brain that can unravel due to stressors, such as failing an exam. Their emotional brain can then go into a cycle of extreme negative thinking. This, combined with changes in their biochemical makeup, can cause actual physical changes in the brain, leading to all the classical symptoms of major depression. During his examination, he had all the symptoms of depression, including low mood, anxiety, fatigue, poor concentration, poor memory, sleep difficulties, loss of self-esteem, and loss of enjoyment in his life.
As John had all the classical symptoms of depression, he was started on an SSRI antidepressant, an exercise regime, and an inclusion of omega-3 fatty acids and a vitamin B complex. As his mood improved, cognitive behavior therapy was introduced to help John correct his unhealthy thinking and behavior regarding college. His parents were also seen to help them improve the relationship with John. As his condition improved, his therapy was gradually reduced, and his mental and physical well-being increased along with his confidence and performance at college.
As it was now over 9 months since his mood had stabilized, his antidepressant was discontinued gradually over the subsequent few weeks. Zhang has now since completed his undergraduate degree and is happily studying for his master's degree.
Many other people also experience similar cases and bouts of depression like John. In fact, 1 in 6 people are projected to experience depression at some point in their life. In addition, there's been a 56% increase in the number of college students reporting depression symptoms in the past 6 years, and suicide is now the 11th leading cause of death in the United States, and also 3rd for young people ages 15 to 24. As depression often causes suicide, it's evident that from the statistics that this is something that still needs to be addressed more often in schools and in daily conversations.